Thank you for joining us. My name is Nancy Miller and I'm the Director of Education and Research here at the Vitality Institute, the makers of the VI Peel. Today we are going to go through the VI Peel Advanced, how to use it, when to use it, and how to get the best results. So the VI Peel Advanced is our deepest penetrating formula. It would be great for your patient who is over 40 because we know after 30 our collagen production starts to slow down. This is also the optimal peel for your patient who has mild to moderate photo damage. We know the sun, the UV rays will damage our cells. Not only are we producing pigmentation as a result of it, but we're losing our collagen and elastin. This is also the peel of choice for your neurotoxin and your filler patients. Again, for the same reason. These are the patients who want to see enhanced collagen stimulation and firming. So your VI Peel Advanced Kit comes with quite a few components, and we are going to go through each of those right now. The first is the Advanced Patient Aftercare Kit. As we complete the application, we will walk through this more specifically. You also receive a 2x2 woven gauze, the VI Peel Prep Towelette, the original VI Peel, which is a measured dose of 5 milliliters, an applicator cup for your peel, and what makes this peel unique is the Advanced Booster. The Advanced Booster provides 0.8 mLs of the same blend, so the retinoic, TCA, phenol, salicylic, and vitamin C. More solution for you means more layers for your patient. And more layers for our patients mean a greater depth of penetration and enhanced collagen stimulation. So our patient's skin is already cleansed. Our first step here is applying the acetone towelette. This is our VI Peel Prep Towelette, and the purpose of this is to degrease the skin. When you open your towelette, it is overfilled, so go ahead and place it upright because you may use that excess solution again. As you open the towelette, step away from your patient because we don't want any of this solution in your patient's eyes, nose, or mouth. So I tend to fold my acetone towelette into quarters. And as you approach your patient, you're going to begin on the forehead and you're going to sweep across. The goal of the towelette is to remove any surface oils from the skin. Surface oils inhibit the acid penetration, so a thorough degrease will assure you get the best penetration from the VI Peel. As you degrease the skin, what you're looking for is a nice matte appearance. Kristen, let me have you roll your lips for me. Great. A nice matte appearance. We don't want any sheen left on the skin. So with Kristen, and what I'm going to do right now is go ahead and grab a little bit more of the acetone, resaturate my gauze, and go back until I feel I've degreased thoroughly. There are other degreasing products you can use, but acetone truly offers the best defatting of the skin. It will also slightly dehydrate the skin, and that will help again in peel penetration and in results for your patient. After you've degreased your patient's skin, take a look at your towelette. Your towelette should still be white and dirt-free. If you note makeup or dirt on your towelette, that means your patient's face was not properly cleansed. So you do need to go back, re-cleanse your patient's skin, and re-degrease their skin. The next step is to prep your VI Peel solution. You're going to go ahead and open the VI Peel vial. Flip top cap comes off, and a reminder, you're going to do this away from your patient's face. There's a little cap, just like a soda cap. You lift that up. You place your non-dominant hand, thumb against the rubber stopper, apply the counter pressure. Each VI Peel vial is under pressure, and this pressure will vary. Sometimes the pressure is light and sometimes the pressure is heavier. As you open the vial, use your non-dominant hand, place your thumb over the rubber stopper and the rest of your hand underneath. Apply counter pressure to the rubber stopper throughout this whole process. Go ahead and lift the flip top, roll it down, remove the collar. Again, continuing to apply pressure. Go ahead and pour the VI Peel into the applicator cup. So as you open the booster, just slip it out of that little sleeve. There is a little button here. What you're going to do is apply pressure and squeeze. There is a membrane that is released within the booster. After you release the pressure in the membrane, go ahead and squeeze that into the applicator cup and give it a slight stir. So the VI Advanced is ready to go. The VI Peel Advanced will be applied with a 2x2 gauze. All VI Peels are applied with 2x2 gauze. This allows for two key factors. The first factor is control. As the practitioner, you're able to apply designated amount of pressure during your application. And the pressure you apply relates to the depth of penetration for your patient and ultimate result. The second factor with the gauze is this is slightly abrasive. So simultaneously you're applying the acid in terms of chemical plus mechanical abrasion to the skin. The gauze can be applied in half or in quarters. Selection of this method is up to you and ultimately is determined by your control. As you begin your application, you want to saturate your gauze. So what you're going to do is place the gauze into the applicator cup. As you see, the solution will wick up the gauze. Now, you do not want your solution dripping off your gauze. This means zero control for you in terms of your application. You do want it saturated but not dripping. So simply apply a little pressure to the applicator cup, remove the excess solution so that it is saturated but not dripping. As we apply the VI Peel Advanced, we are going to start on the most resilient part of the face, which is the forehead. Your application will begin and sweep across the forehead with a medium pressure. You're going to bring down the temple, across the cheek. You can overlap slightly, about 20 to 30%. Come on up the left cheek, again maintaining your medium pressure. And now that your gauze is slightly less saturated, you can go ahead and perform the nose, upper lip, and chin. Sweep the gauze down the nose, along the sides. Ask your patient to roll their lips in. Great. Upper lip and chin. Now that the first pass is complete, your work begins. You're going to look for three key areas. The first is product penetration, the second is patient skin response, and the third is your patient's pain level. So Kristen, on a pain scale of 1 to 10, with 1 being very little pain and 10 being the most pain you can imagine, where are you at right now?
I'm at a 0.
At a 0, wonderful. So Kristen has reported a pain of 0. Her skin response is absolutely normal, a little bit of flushing, and the product has completely penetrated. Pain level with the VI Peel is expected to be at a 4 or under. And the key reason behind a lower pain level with the VI Peel is the ingredient phenol. Phenol, as we know, is an amazing exfoliating acid, but it also has an anesthetic ability. This pass, you will start to apply firmer pressure. So medium to medium firm pressure is appropriate. As you apply the pressure, you will see the skin kind of give way under your hands, under your fingers, and this will let you know that you're applying firm enough pressure to assure that these ingredients are penetrating to the papillary dermis. Now the VI Peel is applied in layers, and each layer you're improving the penetration from that previous layer. So after you've completed the entire periphery of the face, this is the time again that you do the central medial area. So nose, upper lip, and chin get done at this point. Again, you'll sweep down the bridge of the nose, sides of the nose. Ask your patient to roll their lips. We don't treat the lips with the VI peel. The chin, and the pass is complete. In between each pass, you're going to wait 30 to 60 seconds and assess those 3 key areas: patient pain level, skin response, and product penetration. So Kristen, I'm going to ask you again, how was your pain level on this pass?
It's a 0, it's just tingling.
Still 0, wonderful. Again, so her pain level is within normal limits, her skin response is absolutely perfect, slight flushing, and the product has penetrated. How do you determine what pressure you are applying? There's a couple simple ways to determine, are you using medium, light, or firm pressure? The easiest way to determine that is if you were going to apply with a linear pattern, you really don't see the skin give way. That's light, almost like you would be using a fan brush in application. A medium pressure, you apply more pressure and you continue following it through. You see the skin give. Firm pressure, again, is just a little bit level up from where the medium pressure was. Again, place the firm pressure and follow through. Much more skin give below that. So let's proceed with our third pass. Kristen is doing quite well. We assess the areas in between her second layer. So let's move on to our third layer. So at this point you can select to do a crosshatch technique. When you begin on the forehead, again, continuing to increase the pressure on application. You can see the lift to her brows right now as my pressure has increased. You can also select to use that crosshatch down the cheeks. Switch hands, down the temple, down the cheek. Continue applying firm pressure. And again, last area is the medial section of the face, the nose. Have her roll her lips for me, and chin. So that is our third pass. Again, our 3 checks, patient pain level. So Kristen, how are you feeling right now?
It's still a 0.
Still a 0, wonderful. My visual assessment of her skin, she is flushed. Product is penetrating quite quickly. Let's take a look on this side. No issues, wonderful. So now we can go ahead and proceed to our 4th layer. Again, with the VI peel, we're applying in layers. Each layer is creating a deeper penetration of the acids and greater response from the skin. In this case with Advance, we want to continuously apply, and we're probably going to be able to do anywhere from 5 to 6 layers on Kristen, really driving that dermal penetration and that collagen stimulation. So again, resaturate your gauze. Should be saturated but not dripping. Again, apply with firm pressure. Sweep the forehead, down the temple, across the cheek, the other cheek, down the bridge of the nose, the side of the nose, upper lip, and chin. Allow those 30 to 60 seconds to do your assessment, and I will make one suggestion at this point. Sometimes we want to keep touching the skin. Do not touch the skin after you have completed a layer. I often see people wanting to dab the skin. This does not allow you the time to assess the skin response. And what happens is you continue to apply product to certain areas. So you're going to get an uneven application. So resist the urge to keep touching the skin with your gauze. Allow it the time to penetrate on its own. So let's do our quick pain check. Any pain this time?
No, it's somewhere between a 0 and a 1. It's very light, just the tingles and warmth.
Beautiful. So at this point, Kristen has had 4 layers. And there's a couple points that can occur at this area of the application. Like we mentioned before, should only be 30 to 60 seconds between layers and the product will have penetrated. If you are still noting product on the surface of the skin, there are 3 culprits that can have caused this. The first is an improper degrease. If you didn't thoroughly degrease the skin or defat the skin, the acids are going to sit more on the surface. The second is your pressure. If you used a light to a medium pressure, the product again will not penetrate as quickly or efficaciously as expected. And the third is your gauze may have been too saturated. If you had too much product on your gauze on application, you will also see that product sitting on the surface. But there are ways to compensate for that. So if you do note some product still on the surface, with your gauze, before you resaturate, you can go back, crosshatch pattern. Again, this is not an extra layer. This is just a pressure application. You're correcting your pressure, or you are correcting the oversaturation of gauze, or you are correcting possibly too much sebum that was on the skin. Okay, but for Kristen anyway, all of the product has penetrated. We're going to go back for our fifth layer, which will complete the dose because she has used all of the product. And again, we're going to go ahead and apply across the forehead. So if you see product soak in super quick and you're not able to get 4 to 6 layers off of an advanced, the patient may have been excessively dehydrated and the product is penetrating quicker. But along with this, you would have noted some skin changes to your patient. First off, they would have potentially frosted very quickly. They could have had a pain level significant over a 5 or a 6, and they would have had quite a bit of erythema on the skin. Have you roll your lips for me, Kristen? Thank you. All right, so this is her fifth layer. We have used all of the solution. At this point, we will proceed with the eye peel. So Kristen, can I have you look up for me real quick? Great, so lighter pressure here. We're using a light pressure, sweeping the under eye. So you've completed the under eye treatment, and now you can do the brow bone. So have your patient close their eyes and sweep the brow bone. Lighter pressure again, and we are not treating the eyelid area. So we just completed the VI Peel Advanced application on Kristen, and a couple key areas that we want to keep in mind for Kristen in the next 48 to 72 hours. The first is after her peel application, nothing goes on her skin. No sunscreen, no lotion, nothing for the first 4 hours. We know that the acids can continue to function, and especially retinoic acid has the ability to continue to function for up to 4 hours. So nothing goes on her skin, okay? At the 4-hour mark, she's going to begin a little regimen at home. And in her aftercare kit, she has a very detailed post-peel instruction booklet here. But she also has the ability to use the VI Peel post-peel app, which we'll talk about in just one moment. So her aftercare begins at the 4-hour mark. At the 4-hour mark, Kristen is going to use a little bit of our gentle purifying cleanser and cleanse her face with cool water and her fingertips only. So the easiest way for me to explain this to patients is each of these paquettes are good for about 2 to 3 cleanses, okay? So they're going to take a small amount, fingertips only, cool water cleanse their full face, pat dry. After their face is pat dry, no rub dry, right? Pat dry, they're going to grab their first post-peel towelette. Now this post-peel towelette is not a refreshing towelette. This is more acid in here. We have more retinoic acid, more ascorbic acid. And these towelette functions are to continue to stimulate the skin. So you performed an in-office peel, right? 4 hours later, your patient is going to redose their skin with a little bit more retinoic acid. And these towelettes are going to all be done within the first 48 hours and spaced a minimum of 4 hours apart. So regardless if you did the peel in the morning or you did the peel in the afternoon in your office, the patient has a variable regimen of 4-hour intervals between each towelette, as long as they are all used within the first 48 hours. So at the 4-hour mark after Kristen's VI peel, she's going to cleanse her skin with a little bit of the Gentle Purifying Cleanser. These towelettes will be able to do about 2 to 3 cleanses. So the patient will take just a small amount, cool water, fingertips only, cleanse their face, pat dry. Take the first VI peel towelette, apply to the forehead, cheeks, neck, upper lip, chin, anywhere the VI peel was applied, just avoiding the lip and the eye area. They're going to discard their towelette, wash their hands. For patients who are Fitzpatrick 4 to 6, 10 minutes after the towelette application, we want them to apply a small amount of the post-treatment repair cream. The post-treatment repair cream can be used when the patient feels a little bit dry or sensitive. But if the post-treatment repair cream is overused, that will mask or hide the amount of visible peeling. So for some of our patients, they don't want to notice the exfoliation, they can use this. For patients who want to see more visible peeling, we recommend limited use of the post-treatment repair cream. So on the day of Kristen's peel, she has waited 4 hours and done her first towelette. On this same day, she's going to do a second round of towelettes. Now this will be done 4 hours after her first towelette, a minimum, or an hour before bedtime. So she's going to do the very similar protocol that she just did. Cool water cleanse her skin with our cleanser, pat dry, second towelette every place the peel was applied, discard, wash her hands. And for darker Fitzpatrick's 4 through 6, after 10 minutes, a light layer of the post-treatment repair cream. Tomorrow morning, Kristen is going to wake up, she's going to cleanse her skin, she's going to use a little bit of the post-treatment repair cream, SPF 50, and if she'd like to, she can apply makeup. She's going to keep these in her bag and reapply them as needed if she's outdoors or if she feels a little bit dry or sensitive. Tomorrow night before bed, she's going to do the last round of towelettes. Cool water cleanse, fingertips only, pat dry, towelette everywhere the peel was applied, discard, wash her hands, and for darker Fitzpatrick 4 to 6, a little bit of post-treatment repair cream. So we just completed the step-by-step aftercare for Kristen. Now it is all written down for the patient, but a very unique and only available through VI Peel is the VI Peel Aftercare app. This app she can download from the App Store on Google or Android. It is free. At the Vitality Institute, we were created by a practitioner for a practitioner, and the VI Peel app is an extension of that. The VI Peel app not only will help your patients remember those daily triggers of the towelette or using the post-peel or using their sunscreen, but it will give them tips to achieve the best outcome. It will send them push reminders so that you don't have to spend extra time reminding your patient of the steps. It has a beautiful FAQs that answers so many of those commonly asked questions so that your patient is more satisfied in the end. So the post-peel app really is your resource. It is you in your patient's back pocket being able to communicate, best tips and tricks and care for their skin in those 7 days post-peel.